Delivering a healthy activity program session. Let's start by looking at a case study. Anjana is a 35-year-old woman who has 2 children. Her husband has a drinking problem and has not kept a job for years. She complains of tiredness, backaches and headaches. She feels helpless and demotivated about the future. Finds it difficult to cope with financial pressures and the conflicts with her husband. Anjana stays in bed a lot and avoids her neighbors. Her sleep is disturbed and she's eating poorly. Anjana is experiencing depression, which she describes as tension. Phase 1 is typically delivered in 1 to 2 sessions. The goals of Phase 1 are engaging and establishing an effective relationship, helping patients understand the healthy activity program, and obtaining commitment for counseling. The structure of Phase 1 session. We start by introducing ourselves, establishing agreement about the length of the first meeting. We move on to setting an agenda and getting to know the patient. Assessing suicide risk is an important component of this phase. Explaining the healthy activity program and providing hope and encouragement. We move on to talking about the specifics of counseling and involving a significant other. We obtain commitment towards the treatment and overcome barriers that the patient may have towards completing treatment. Addressing the patient's chief concern, example, referral to social agencies or advice to sleep problems. Planning homework and summarizing. Finally, setting the date for the next session and completing documentation. The outline for an abbreviated session. We start by introducing ourselves. We establish agreement about the length of the session. We provide a brief description of counseling with an emphasis on providing encouragement and hope. We assess suicide risk based on the PHQ-9 score. We set the date for the next session. We explain that important issues that could not be covered, like patient's problems, the effect on his or her health, and specific aspects of the counseling will be covered in the next meeting. Provide the patient booklet and encourage the patient to read the first page before the next session. If the patient cannot read, they can ask the significant other to read and explain the information to them. Finally, complete the documentation.